Today, we're introducing our very first guest of this season, and someone not short of fascinating to me at this point. He started his career in biology as a microbiologist and moved and transitioned over time into bioterrorism. As the career moved on, he's transitioned into the United States Air Force as a public health officer and served in North Carolina as an Air National Guard as a public health officer there as well. Currently, he's holding two hats as a lieutenant commander at the U.S. Public Health Service and a project manager at the FDA. And just like all of us and a lot of prospective students watching this podcast, he is also an alum at NYU GPH from 2012. But rather than me introducing him, I'd love to hear from him himself. James Betz, welcome to the podcast.
Oh, thank you, Aman. I really appreciate that. That was quite the introduction. And, I'm just thankful to be able to come on here and talk to everybody about my public health experience and my kind of career thus far. So I really appreciate it.
We love to have you here, and we're so excited to chat with you today. And just as I introduced you, it's so many things that I mentioned. How I'm so curious to learn about your journey, microbiology, bioterrorism, to the U.S. Air Force, and currently you're at the FDA, multiple hats. And I feel like you've gone through so many lives, and there's still many more lives to live.
Yes.
What's that journey been like, and how has your path changed over the years? What's formulated this path?
I mean, it's definitely changed a lot. And that's one of the things that I actually enjoy change. And, coming up when I was a little kid, I always wanted to be, a scientist. I always wanted to, kind of, break things down and understand them and be able to work them back together. And, as I went through my undergrad career, I wanted to major in biology. I really wanted to just explore, nature and the natural order of things. And one of my favorite books was The Hot Zone by Richard Preston. And my favorite movie was Outbreak. I wanted to be Dennis Hoffman in Outbreak. I know that sounds cheesy, but, maybe I was too young to be watching that movie, but that's kind of really what I wanted to do. And so I kind of started focusing, when I came to, graduating, I got a job working as a microbiologist. And I started learning, lab science and bench science, and I just loved it. I was having a phenomenal time. I was, kind of opening up paths that I had never thought about before, and knowledge that, you get it in the academic sense, but, to apply it, where I'm learning about, infectious disease and how we treat things and how the hospital system works. I was at Mount Sinai as a microbiologist there, and I met so many great mentors and folks that kind of, taught me things that I, never even imagined, and was able to, basically you're directly affecting the care of the patient by, potentially recommending antibiotics to the doctors on call or the nurses. And so it's just an awesome career path. And then I started, as I started to gain more experience and meet people, because that's one of the biggest things that you can possibly do as you, embark upon your career, is just, I call it shaking hands and kissing babies. You really, you get out there, you go to conferences, you're involved in societies, you rely on your alumni network. And I actually got called and recommended, like, hey, I got this position opening here in the New York City Department of Health to be a supervisor in the bioterrorism lab. And I literally dropped the phone. I was like, oh my God, this is my life dream. This is exactly what I want to do. And it was just awesome. I mean, it was everything I imagined and more. I was learning advanced molecular techniques, going into the lab, gowned up in BSL-3 environment, looking at, anthrax and tularemia and all these crazy diseases that you hear about and I've read about and I knew about. But to really do that was just a phenomenal experience for me. And it also started tickling my fancy a little bit with some other stuff. I'm like, okay, I enjoy the lab. I enjoy, all this science, but I like people too. I'm a very big people. I love talking to people. I love meeting people. And I think it's like key to kind of foster your professional development, to kind of always keep your eyes looking forward and always be flexible. Being flexible and being a dynamic, professional is one of the most important things you could do for your career, because you just never know what opportunities might present themselves. So one of the things that a saying that I learned when I was in the Air Force that I kind of was doing passively but didn't realize is it's bloom where you're planted, right? So you're not going to be or play the cards you're dealt. You don't know what the career landscape is going to be. When I graduated undergrad in 2005, we started one of the greatest recessions we've ever had. So, you don't know, you're not necessarily going to get the job you think or go down the path you think. But when an opportunity presents itself, you hopefully are there to open the door.
Mm-hmm.
And how that kind of played into my career is I was doing, the bioterrorism lab thing. And I'm just like, I want to do a little more. And so it actually, ironically enough, during the last pandemic we had, which was H1N1, we were uniquely positioned to respond with a lot of the molecular techniques that we did to diagnose rapidly. So we were part of one of the first waves of labs that actually was working with H1N1 in terms of, testing patients to determine whether or not they had it. And I was on calls with the CDC and, the FDA, because they were the ones for the diagnostic techniques, and all these epidemiologists and scientists. And I'm like, that's where I want to go next. And how do I get there? And that's kind of where NYU came into play. So.
Wow. Wow.
And that's just, kind of,
yeah.
I really wanted to take a step back and kind of look at my careerscape and say, well, all right, I have a goal now. I've done all this cool stuff. I've really enjoyed it. It's, awesome. And I could do this forever, but I want to take the next level. And so, I was looking at master's in public health programs, and two really stuck out to me. And the one was Columbia and the other one was NYU. And it's ironically enough, I wanted to go to NYU as an undergrad. Unfortunately, I didn't get in. I was like, oh man, but I never, I didn't. So when I applied for the programs, I knew, I was like, I want to go to NYU. It was very fulfilling for me to kind of be able to apply and be accepted. I was one of the best days I've had. It's when I got that acceptance letter. I was like, oh, this is going to be so awesome. And part of that comes with also, you got to paid for tuition and everything like that. But I was actually given a unique opportunity from the United States Air Force. And I applied for a program where they would they would pay for my master's. And then I'd be able to commission as an officer while going to school and then be there after. And that was just such a huge change in my career, but a welcome one. It was amazing. So I was able to really focus on going to school at NYU. And one of the things that I would tell current students is take all that time, be a part of all the things that NYU has to offer. In the varying career field of public health, you don't know where your path might lead, because there are people that are hardline biostatisticians or epidemiologists. But then you have something, and this was introduced to me on my NYU experience. This was one of my first classes, was the social determinants of health. And it's things that I had never even thought of before. And it just blew my mind. I'll never forget. I'm sitting in that class for social determinants of health, and we started talking about some of the things. And I mean, jaw was like, aha, of course, this makes sense. I had never thought of it that way because, for so long I had been training in terms of hardline science. I never really thought about, wow, when you take a step back, these are some of the other things that you can do. And then, you have your classmates, and they're you guys are all going through that. And it's very important to maintain those relationships, throughout your career. And I'll kind of circle that around in a minute. So it really prepared me well for being a public health officer in the Air Force, because I went in, I'd had to go to officer training school. I was gone for, a little while. Can't even remember it, kind of pushed it out of my mind. And I was basically running my own mini department of health there, with larger goals in mind. So NYU prepared me because it really gave me the whole, package in terms of public health. I went and I took, all the epi and the biostats and the community health courses. And then as I entered the Air Force, I was responsible for community health and emergency response and things like that. So it was just such a remarkable experience. And the funny thing is, as I, sort of went through my career in the United States Air Force and did just amazing things, and worked with just phenomenal teams and people, you know, ranging all sorts of, you know, perfect things in public health. I wanted to do more. And I was actually here, I'm in Charleston, South Carolina. And, you know, I love the Air Force. We were starting a family though. And I was like, well, I need to kind of, you know, start writing my next chapter here. And so that's when I sort of transitioned from the Air Force to what's called the Public Health Commission Corps. And we're one of the now 8, because we have Space Force, branches of the Uniformed Services. And there's about 6,000, 6,500 officers, doctors, lawyers, nurses, and health service officers, what I am. And we work for the Surgeon General of the United States. Our job is public health. And that's what I do. And so now, you know, public health has become increasingly in vogue because of our current pandemic. We have COVID. And so, you know, it's been an awesome career field. And so in the Public Health Commission Corps, I work for the FDA and help them doing kind of food and food emergency response, and kind of help the interplay between the federal and the state level. But probably one of the best things I've done is when COVID started last year, I actually was one of the first people to deploy as part of our, you know, government response to COVID-19. And I got to deploy as part of a program to stand up the testing sites that were kind of popping up all around the country. So we were the ones kind of spearheading that effort. So, you know, it was tough. You know, you're facing down, we don't know what COVID is, right? But here we are where I'm like, all right, you know, I have 4 children and I'm like, all right, you know, this is what, you know, this is what we've prepared for, you know, this is, you know, what we are here for. And so, you know, to look at my wife and kids and have to get on an airplane while COVID is kicking off, and travel, you know, 1,000, 2,000 miles away to do my job. And people, this is back when we were washing groceries and nobody knew what things were happening. So it was very tough, but, and, you know, kudos to everybody on the front line in public health and in direct care and every, you know, local public health. I mean, you know, it's a tough order and everybody's kind of stepped up, and that's kind of the power, I think, that public health has, is that, you know, nobody knew about it. And I remember one of my professors, you know, first semester, she's like, you are stepping into a career that, you know, nobody knows what you do. It's going to be very hard to explain to people, but when you have to, it's probably not going to be great. And so those kind of words ring true. It's like, yeah, you know, they're the people that you don't want until you need them, right? So
yeah,
it's just such an awesome, you know, path.
Oh man, you walked me through a journey, and I loved every minute of it. I'm. There's so many questions I have.
I'm here to answer them. I can't wait.
You briefly touched upon what NYU gave you and how you have transitioned over here, and I'm thinking of how to frame this the best way. So so let's take a step to the current world, and you have lived 1,000 lives at this point, served tremendously, and have a great team, and met fascinating individuals also that are in this amazing industry, as you have described so well. Even though you said it's going to be tough to describe, I thought you did a pretty good job at it so far. I'm curious to know, looking ahead, where do you see opportunities, or where should the young professionals in today's world take their mindset? Where should they be looking in order to make an impact, as some of them describe, or perhaps even choose their trajectory? As you said, that you never knew what a trajectory is going to be. What's going to happen? What would be some ideas you could have for them, where they have either a designated path, either a pretty uncertain path? What would you suggest in terms of that?
Well, you know, now, you know, we're starting to see, hopefully, you know, based on the latest news just this week, you know, we're seeing a transition in the, you know, pandemic response, hopefully a positive direction. And public health isn't going anywhere, right? And now we're going to be seeing a lot of more of the long-term effects from basically 2 years of stress and strife and just worry. And that's what's so great about public health and a lot of the people that are involved in this is that there's a need for the long-term, not only mental health response, because that's so key in what we've found out. When you're on lockdown for 6, 7, 8, 9 months, it weighs a toll on people. And that's where the community health response and the designing programs and assessing what's going on in the community and being a part of whether it's an NGO, a private company, local health, local public health, or state or federal, find something that drives your passion. My passion has always been people. I just want to help people, the most people, in the best possible way. And you know what? That might be your passion. If that's it, then focus on that community health. Focus on being able to understand, assessing community health needs and responding appropriately, designing programs. Those are the kind of careers and the people that we're going to need going forward as we, engage in the post-pandemic response. And if you really just love math or love Excel, which, part of me sometimes does, right? And you just love biostats, then, take that and drive with it and always seek opportunities, because that's one of the great things about New York and NYU in particular is there's no shortage of opportunities, whether it's through campus or just through, I know several alumni that interned at, the New York City Department of Health. They love, taking interns from NYU because they know, like, once you are shown that world, you're going to want to not stop, right? It's just such a wonderful organization. And there's hospitals, NYU Langone is phenomenal hospital. And I just know that, whatever you feel is just cool. Like, I want to do this. Don't stop. It might not be a straight and narrow path. You might have to do, something slightly different, but always be adding to your toolkit, always be adding to your public health toolkit, because believe it or not, it is a science and it's an applicable science, and everything you learn can push towards your career goal.
Yeah. So folks, what I got out of that is strive for the passion. Take whatever that funny bone inside is tickling, look at it and pay attention to it, because that will incite something much deeper, and focus on the toolkit. Let's try to develop our skill sets and take it to the next step, because the two will go hand in hand for a great future.
Yeah. And you'll never stop learning either. That's the thing. You grind hard through grad school, and then you start in your career field, and guess what? It's a non-stop learning environment, because we have to be on the cusp in the forefront of everything, science, tech, trends, what's going on in the world of public health. As we know, it's kind of been turned on its head in the past couple of years, and also the people you meet. That's very, very important. I have a funny story. It's when I worked at the New York City Department of Health, I had two acquaintances there. And, one actually trained me in all the stuff I was learning, and he actually departed about a year afterwards. And, hey, you say your goodbyes. Hey, if you ever need anything, let me know. He took another position, and then another friend, I left, and he stayed on. And fast forward 5 years later, and lo and behold, my current position as a public health commission corps officer. One is actually a public health commission corps officer working at the Food and Drug Administration, basically almost 6 degrees of separation away from me in terms of their job. And another one is a project manager at the FDA, and I've worked with him on several things. So it's funny because you just don't know the individuals that you meet. And one of them is actually really good friends with him now. He has kids. We follow each other on Instagram, things like that. So it's just, you just don't know the people that you meet, what impact they're going to have later on, because it may seem like a big world, but trust me, it is not.
Certainly, networking is, and NYU, I think, provides, or any school for that matter, provides
Yes.
that extraordinary opportunity of networking and having everyone in one place that are going to take these different paths. Let's take a bit of a transition, because we can go down so many
Oh
lovely
yeah.
paths. But let's talk a little bit about, you've been in this field since '05, and a very long time. And how has the industry changed? What
It's not that long, right? I know I got gray hair. I'm kidding.
No,
No,
hey, I got to tell you, you still look great, and you're going to keep looking better.
thanks. No, it's changed so much, and the field of public health, and just it's a lot of it is government centric, right? Um, and I look at my career, and I think a big pivot point for me, I think I said previously, was when I was in the New York City Department of Health, and we started ramping up for the H1N1 pandemic response. And I saw the interplay between the federal government and the state government, the local government, and even industry, because they're coming out and they're like, hey, we can pump these, tests out, kind of like what we see now. And I think emergency response is something, it's a very critical part of public health that I think has not very recent, but more recent than most other, disciplines in public health. And it really is born, I think, unfortunately, out of the post 9/11 era, and that we understand how to respond to emergencies better, born out of tragedy, unfortunately. But that's part of, the human story, is responding to, what is a catastrophic event, but let's make it better. How do we make it better going forward? And that's kind of one of the cruxes that I love about public health, is going forward from anything, whether it's 9/11, or even we have a train derailment or things like that. Emergency responders, they hot wash those things and say, what went wrong? How can we make this better? And that's what happened during COVID. We saw it live playing out on TV, and unfortunately, a lot of it has been politicized, or why at the beginning of the pandemic did you say something like this and then it changed? Well, you're seeing science play out live. Emergency response is, how do we make things better? How can we improve upon our outcomes? And that's what we want. We want to help people in the best way possible. So I think that's kind of how things have changed over time, is we are always striving to get better at everything we do. And, I think one of the keys in doing that is to constantly talk about, okay, well, what went wrong? And I think a lot of people in normal sight, they don't want to approach, well, what went wrong? But it's something that you have to be able to kind of, say in the field of science and the field of public health. It's, okay, how can we do better? The, process improvement is key.
Yeah. And you're mentioning, so when I listen to this, that you're mentioning it, it sounds to me, it's not taxing, but there's so many things going on, right? And you have 1,000 things in your mind, even simply as a viewer, perhaps on our end, where I'm just listening and watching TV and understanding what's going on. You're in the trenches. So what is that? What fuels you every day? What kind of keeps you going to do this every day, and again and again, and with that awesome smile on your face? Like what is that?
It's something I mean, my whole life I've always known this is kind of my passion. And for other people, they find that motivation in different ways. But when you know that you want to do something, it's I know the phrase is beaten to death, but when you truly love what you're doing, you never will work a day in your life. And that's kind of what I feel, like this truly is just amazing. And there's challenges, and you need to be challenged, I think, in life. There's challenges every day when I, embark upon, my job. And it's great because you really have the opportunity to kind of, break it down. COVID is probably one of the greatest challenges that we've had. It's really, truly like the Gideon's knot. Like every time you untie something, there's just more and more and more. And now, it's you really have to have that stamina. And it's something that I think through the challenges, you come out stronger. And that's why, NYU, it was hard. It was hard to, the program, I every day you're going to school and you're learning and you're studying, you're doing more intensive reading than you probably did as an undergrad. And you're looking at things that you might not have looked at before, and you're working in groups, and, you're trying to probably juggle maybe a job and an internship. And, those things help to kind of prepare you for, hey, if you're in this sort of, area of public health, like what I'm basically doing now, mostly emergency response, every day can be taxing. But, it's, you just have to find that motivation every day, because what else is taxing? Seeing patients and being in an emergency room, or, acute other forms of acute patient care, people that might be in that setting, so, because that's a big aspect of public health, so.
Yeah. Oh man. So you have made such awesome transitions as well in life, and I'm just curious to know what do you think when you're thinking about your future and what's next? What's a passion project currently? Anything interesting down the line that might even inspire other students, perhaps, as per, hey, follow your path, and this is a newfound passion of mine.
Yeah, I mean, I'm constantly looking on the forefront. I'm really, as a public health officer, I'm constantly trying to just meet new officers, understand kind of the interplays between various agencies. Looking at how the FDA and the CDC play out, and kind of my current role. I'm really largely responsible for projects that occur between the federal government and the state and local government. And, we have learned just so much, even just during the COVID pandemic, on how, resource constrained certain environments are and how some aren't, and how that varies across the country. You have very robust programs in some areas and ones that need a little bit more. So kind of going forward, one of the things that, I know my agency is working on is really trying to develop and flesh out what they call the integrated food safety system and domestic mutual reliance, which is, we in government, you operate in a very fiscally constrained environment. How can we impact public health the most through utilizing resources appropriately? So, really taking data and information from two different parties and being able to utilize that in a way that it will, affect change. And that change in my agency is to prevent, disease, death, and otherwise undesirable outcomes. So that's, kind of what I'm looking forward to in the next few years, is the shifting landscape of how, we do things, from a public health standpoint, in the federal government. So just trying to make process improvement changes and do things, as best we possibly can.
Man, thank you for all you're doing. It's lovely to hear all of that, and I'm sure uh, listening to this, a lot of folks themselves are finding their what strikes their chords inside, and helping them get to the next step. I'd like to leave you with a final question. So we all have that one passion we were talking about, our public health path, perhaps. If you had a magic wand today, what's the one biggest scenario you'd like to solve with that magic wand?
I
Just
mean,
to
I
hear.
I would eliminate COVID and all the post-pandemic issues immediately. It's an unfortunate pandemic that has really affected all aspects of our life, and and we're seeing it too now playing out on the economic end and the supply chain end. I know I'm in the Food and Drug Administration. That was one thing that very early on, our state mission partners were able to, directly relate and talk to all the major food producers in their state. We, as the federal regulatory body, couldn't reach down as quickly as the states could. So, now we're starting to see, we kind of had a pause. Everything kind of started ramping back up as people were able to, start to go back to work. But now we're starting to see, the tide shifting a little bit more. And so, of course, like just, eliminating this and getting back to the post pandemic world would be just, of course, exactly what I would do. I think anybody in public health, I think they would say the same thing or something similar.
Something similar.
Yeah. And
I
because we
love
have
it.
to start to pivot too, to start to tackle the challenges in health and healthcare
Mm,
that maybe got not pushed to the side, but there's a lot of other issues out there that we have to start solving.
yeah. Folks, what a lovely conversation. Follow your path, network, follow that passion. Lots of beautiful things are going to come out because this industry requires all of us to make a difference. And we're glad that all of you tuned in for this podcast. James, it's been a pleasure chatting with you throughout.
Yes, absolutely. It's been a pleasure to chat with you, and thank you so much for the opportunity. And good luck to everybody at NYU. I know that you have made the right choice. It's a phenomenal school.